What is the history of Paget's disease and ancient bone health? Have you ever wondered about the history of Paget's disease and how it relates to ancient bone health? Paget's disease of bone, also known as osteitis deformans, was first identified in 1876 by British surgeon James Paget. This marked a significant moment in understanding a distinct metabolic bone disorder. Paget's disease is characterized by abnormal bone remodeling. It involves excessive bone resorption by cells called osteoclasts, followed by disorganized and excessive bone formation by osteoblasts. This leads to bones that are structurally weak and deformed. Over time, our understanding of Paget's disease has evolved. Initially, it was recognized through clinical descriptions. Now, we know more about its pathology, including the characteristic mosaic pattern of bone that can be seen in affected individuals. Paget's disease can affect any bone but most commonly involves the pelvis, spine, femur, tibia, skull, humerus, and scapula. It tends to be more prevalent in older adults, usually appearing after the age of 50, and is quite rare in younger populations. When we look at ancient bone health, studies of skeletal remains from archaeological sites have revealed evidence of bone diseases that resemble Paget's disease. These findings indicate that metabolic bone disorders have existed for centuries. However, identifying Paget's disease in ancient bones is challenging due to the limitations of diagnostic techniques available in the past. Ancient bone health was influenced by various factors, including nutrition, physical activity, and disease, all of which affected bone density and strength. The detailed understanding of bone remodeling processes and diseases like Paget's disease has emerged only with modern medical research. In the context of osteoporosis, Paget's disease shares some overlapping features, such as weakened bone structure and an increased risk of fractures. However, they differ in their underlying mechanisms. Osteoporosis primarily involves a decrease in bone mass and density due to an imbalance favoring bone resorption over formation. In contrast, Paget's disease involves excessive but disorganized bone turnover, which leads to structurally abnormal bone. Treatments for Paget's disease often include bisphosphonates, which are also used to treat osteoporosis. This highlights a therapeutic link between these two bone conditions. In summary, Paget's disease was first described in the late 19th century and reflects a chronic disorder of bone remodeling. Its historical roots can be traced through studies of ancient bones. Understanding the differences between Paget's disease and osteoporosis is crucial for accurate diagnosis and management of bone health conditions. If you have concerns about bone health, it is always best to consult a healthcare professional for personalized advice.